بسم الله الرحمن الرحيم. أنا هيثم نبيل, final year medical student from Baghdad College of Medicine. Welcome again to antibiotics in a clinical practice. In this video we are going to talk about macrolides. راح نحكي عن spectrum of activity والclinical use of common macrolides اللي هي الماكروليدز الحقيقة تستعمل بكثرة يمنا. الagents هي الكلاريثرومايسين and azithromycin هي most common agents اللي هي used. There are also erythromycin and telithromycin which is a ketolide rather than a macrolide. يعني اكو اختلاف بالستركتشر, مسوين modification بالستركتشر بحيث طلع هذا الكيتولايد. The spectrum of activity they are good for atypical infections, atypical bacteria, Haemophilus, Moraxilla, Helicobacter and Mycobacterium avium. Moderate for strep pneumonia and strep pyogenes. منهم نلاحظ على الجود والمودريت activity, نلاحظ بأنه then الantibiotics cover most of the bacteria species اللي هي responsible عن respiratory tract infections. الستريبت نيمو والatypical bacteria والهيموفيلس انفلونزا. They are poor against staph, intergram-negative rods, anaerobes, and enterococci. So, macrolides are among the antibiotic used most frequently in the outpatient setting because of their broad coverage of the respiratory pathogens. لما شفنا spectrum of activity, تسوي هي coverage. It is broad, but it is not deep coverage of the respiratory common species, bacteria species اللي مسؤولة عن respiratory tract infections. نقول بأنه though their coverage is broad, it is not particularly deep. يعني هي مو best agents, بس هي تسوي coverage للmild respiratory tract infections. فلهذا هي تستعمل outpatient most commonly. They are risky choices as monotherapy for patients with an infection that is any worse than mild. يعني ما يصير نستعملها كمونوثيرابي إذا البيشنت عنده moderate to severe respiratory tract infections. أما نستعمل غير دواء which is better, أو نستعمل macrolide but should be combined with another drug. إن ما تستعمل وحدها إذا كان البيشنت عنده moderate to severe infection, but they have a broad coverage for mild respiratory tract infections. الستريبتوكوكال نيمونيا الحقيقة developed نتيجة هذا الوايد use of macrolides developed resistance للماكروليدز. وهذا لما صار resistance scientists modified the structure of macrolides to produce the telithromycin, the ketolide, which has a better activity against streptococcal pneumonia. The macrolides are bacteriostatic drugs. واحنا قلنا انه البكتيريوستاتيك drugs والبكتيريسايدال drugs مو كلش ندير لها بال الا في حاله وجود infections يحتاج لها بكتيريسايدال activity اللي مثلها المننجايتس والاندوكاردايتس, وحكينا انه اوستيومايلايتس وغيرها. The clinical use, they have upper and lower respiratory tract infections that are mild rather than moderate or severe. Chlamydial infections خصوصا بالجينيكولوجي. كلاريثرومايسين هو واحد من الايجنتس بالاتش بايلوري ايراديكيشن ثيرابي, هو والاموكسيلي والمترونيدازول والبي بي اي. Remember, cough and cold is not a sign of azithromycin deficiency. Patients usually have mild respiratory tract infection and non-specific respiratory tract infection. They are most commonly caused by viral pathogens rather than bacterial. So not every patient who has cough and cold should be prescribed an azithromycin. Don't rush to use it because this overuse of these agents has led to antibiotic resistance among them. In summary, azithromycin is good for strep infections, but it is not deep, means that resistance has developed to this azithromycin. and atypical infections, mild activity against gram-negative rows. Erythromycin has better activity against streptococcal pneumonia infections and atypical infections. Overall, they are used for mild respiratory tract infections and chlamydial infections. These are the references, and thank you for watching.